St. Jude's was known for its cutting-edge treatment and its proud reputation and institution that the community turned to in times of crisis. But today, something was off. Stay with us to see what unfolds next. Elijah West walked into St. Jude's with the kind of quiet confidence that came from years of dedication. He was a man who had earned his position the hard way, not through privilege or connections, but through sheer effort, intellect, and resilience. A Black American, the Public Health Commissioner for the state of Illinois. A position most people of his background, and especially his age, would never have thought possible, let alone achievable. But Elijah had defied the odds. At 42 years old, Elijah's career had been a testament to perseverance in a system that hadn't always been kind to him. Raised in the South Side of Chicago, a neighborhood marked by its struggles, Elijah had always known that success would come not from taking shortcuts, but by rising above expectations, both his own and society's. He had spent over a decade climbing the ranks in public health, often going unnoticed, until the moment the state government appointed him as Public Health Commissioner. But that title didn't come without its struggles, particularly in a political landscape that didn't always prioritize the health of Black communities. That was why he was here today. Elijah was at St. Jude's for an unannounced surprise inspection of the hospital's emergency care procedures. The hospital had been flagged for potential breaches in protocol, especially regarding its treatment of underprivileged, primarily Black and Hispanic communities in the area. It was a routine visit, yet it held deep significance to Elijah. His career, his community's well-being, and his personal integrity were on the line. Elijah's eyes scanned the busy reception area as he walked in, noticing the staff moving quickly, seemingly unfazed by the fact that a high-ranking official had just entered their midst. Behind the reception desk sat Janet Williams, known to her friends and co-workers as Janie. A 25-year-old woman, not yet seasoned by the trials of life, but hardened by her job's endless demands. She had been working at St. Jude's for just over a year, her entry into the healthcare field driven more by necessity than passion. With a salary of $16 an hour, Janie wasn't making much, but it was enough to get by and send some money back home to her family in Ohio. Her job at the front desk was often monotonous, checking in patients, answering calls, and dealing with everything from minor inquiries to full-blown crises. But today felt different. She could sense a shift in the air, a tension that she couldn't quite place. She had no idea that the man about to stand in front of her was the state's Public Health Commissioner. When Elijah approached the desk, she looked up briefly, her gaze cold, a thin layer of boredom covering her face. "How can I help you?" she asked, barely masking the indifference in her voice. It was a greeting she had perfected, nothing too welcoming, just enough to get through the day. "I'm here for the inspection," Elijah said, his voice firm but calm. "Public Health Commissioner Elijah West. I'm scheduled for a walkthrough of the ER today." Janie didn't immediately respond. Instead, she quickly glanced at her screen, fingers still typing away in a blur. And after a moment, she looked up at him. Eyes scanning his attire, nothing about him screamed high-ranking official to her. "I'm sorry, you'll have to wait," Janie said, not bothering to ask for further identification. "We're backed up. Someone will be with you shortly." Her words were dismissive, almost mechanical. Elijah paused, momentarily taken aback by her response. He felt the weight of his title and the years of hard work pressing on him, but there was a deeper feeling, a sense of being treated like an outsider despite his position. It wasn't just about the inspection. It was about how he was being perceived and treated. "I understand," Elijah said, his voice steady but edged with frustration. "But I'm not a visitor. I'm the Public Health Commissioner. This is not a simple walkthrough. I'm here to evaluate the hospital's compliance with state health standards." Janie didn't flinch, her face remaining impassive. "I said, you'll have to wait," she repeated, her attention already drifting back to her screen. Elijah could feel the simmering anger rising, but he fought to maintain composure. He wasn't just Elijah West, a Black man walking into a public institution. He was Commissioner West, and he had a responsibility to his community. He couldn't let this moment slide, even if it seemed trivial to her. Frustration began to build, and Elijah stepped closer, his eyes locked on hers. "Do you have any idea who I am?" he asked, his voice now cutting through the air. Janie looked up at him, a flicker of annoyance passing over her face. "Yes. I heard you the first time," she snapped, clearly irritated by the perceived confrontation. Elijah's patience was beginning to wear thin. "I'm here to ensure this hospital meets the health standards for Black and underprivileged communities. Your job is to help me with that, not make me wait like I'm some random visitor." Janie stared at him for a moment, her hand resting on the keyboard. "I don't know who you are, and I'm just doing my job," she muttered, clearly uninterested in the implications of his words. It was the moment when everything shifted. As the tension escalated, Elijah turned away from the desk, his frustration palpable. He had been dismissed, ignored, and now he realized this wasn't just about him. It wasn't just about the inspection. It was about the systematic disrespect Black people faced every day, even in places where they were supposed to be served. The realization hit him hard. The system was broken in ways he hadn't even considered. He stepped aside and made a call to his assistant. "Cancel the rest of my meetings today," Elijah said, his voice low and purposeful. "This hospital's practices are under review. We need to put the sanction in motion." Janie glanced up just as Elijah turned to leave, his phone pressed against his ear. She had no idea what was coming, but the truth was about to hit St. Jude's hard. Later that evening, Elijah's team sent the official report to the state's health department, and within hours the hospital was under investigation. By morning the news spread, and whispers began to stir in the corridors of St. Jude's. The hospital, once considered untouchable, was about to face consequences for its neglect. But this was just the beginning. Elijah wasn't done. He wasn't about to let this slip away. What he uncovered about the hospital's treatment of vulnerable communities would send shockwaves through the state and the country. The night passed slowly for Elijah West. The phone calls, the emails, the unending series of briefings. He didn't sleep much, not with the weight of what he had uncovered at St. Jude's pressing on his mind. By the time the first rays of dawn peeked through his apartment window, he had already started the process of drafting his official report. His fingers hovered over the keyboard, the quiet click of each key punctuating his thoughts. As the public health commissioner, Elijah had the authority to initiate state investigations, but he didn't take that responsibility lightly. What he had seen during his brief time at St. Jude's wasn't just about inefficiency or miscommunication, it was about systemic neglect, a deeper, more ingrained issue that had been festering for years. As Elijah sat at his desk, his thoughts wandered back to the ER, to the patients in the waiting room, to the overcrowded hallways he had walked through. St. Jude's wasn't a hospital just for anyone. It was the hospital that served the lower-income neighborhoods, communities that were predominantly Black and Hispanic. And, as he had discovered, these patients were treated differently. Elijah had heard the complaints over the years: patients forced to wait for hours for basic care, staff members who were overwhelmed, policies that seemed to turn a blind eye to those who couldn't afford to make their voices heard. But it was the stories he had seen firsthand that stung the most. He remembered one elderly woman in particular. She had been waiting for over 5 hours with a broken leg, her face etched with pain, her breathing shallow from the agony. The nurse, overwhelmed by the backlog of cases, hadn't even made eye contact when Elijah approached her. It wasn't just that she hadn't responded to the woman's pain, it was the subtle signs that made Elijah realize this hospital had been operating like this for far too long. By noon the next day, Elijah's office had sent an official notification to the hospital's administration, with copies to the state health department. The message was clear: St. Jude's Medical Center was under review for neglecting the basic standards of patient care, particularly within marginalized communities. The findings included multiple incidents of racial discrimination, overcrowding, and a lack of proper care protocols. The email was blunt and to the point: But Elijah knew the gravity of what he was setting in motion. He called his assistant, Nadine, and instructed her to get in touch with his colleagues at the state health department to ensure the investigation moved swiftly. "We need to ensure the investigation is thorough," Elijah said, his voice low. "This isn't just about correcting a few mistakes. This is about holding them accountable for a system that's been failing for years." Nadine, ever sharp, nodded. "I'll make sure they understand the urgency. Anything else?" "Elijah," he said, his voice trailing off, "there's more going on here than we know. I need you to dig deeper. Start looking into patient complaints about the ER. I want to know the real story. Who's been ignoring these reports for so long?" Within hours of receiving the official report, the hospital's CEO, Richard Calloway, a man who had been with St. Jude's for over 2 decades, was already on the phone with Elijah. Calloway was a man of power, known for his smooth talk and polished demeanor. He was the kind of leader who preferred to resolve things behind closed doors, far away from the public eye. "Elijah, I'm disappointed to see this report," Calloway said, his voice thick with feigned concern. "I assure you we take these matters seriously, but we both know this is a misunderstanding. A few incidents. We're a hospital. It's hard to keep up with everything. These things happen." Elijah's hands tightened around the phone. The way Calloway dismissed the issue, the way he downplayed it, it was infuriating. But Elijah kept his voice calm, his years of political experience helping him maintain control. "Mr. Calloway," Elijah said, his tone measured, "it's not a misunderstanding. It's a pattern. And this is the reason I've requested a full review. The neglect, the overcrowding, the mistreatment, it's systemic. And you're responsible for it." Calloway's silence on the other end of the line told Elijah everything he needed to know. The CEO wasn't used to being challenged. "We'll be looking at the broader picture, Richard," Elijah continued. "We've already started looking into patient complaints, and there are more than you think. This is going public whether you like it or not. The state is going to hold you accountable for the way you've allowed this hospital to treat vulnerable people." By the following day, Elijah had successfully convinced the state health department to launch a formal investigation. Word quickly spread through the hospital's network, and the hospital staff, once silent in the face of internal corruption, began to speak up. One by one, employees came forward, giving testimonies about the hospital's flawed practices and policies. But the real kicker came when Nadine sent Elijah a file that had been buried deep in the hospital's archives, a document that showed how the hospital had repeatedly ignored safety violations, especially in the emergency room. Elijah's eyes scanned the pages, feeling a growing sense of disbelief. There it was, in black and white. The hospital had been deliberately understaffed, cutting corners in the ER to maximize profit, while ignoring clear regulations meant to ensure patient safety. And on top of that, patients of color were disproportionately affected. That evening, the state issued a public statement, and the media picked up on it quickly. News outlets across the state began covering the story of a public health commissioner standing up to a hospital that had been turning a blind eye to its responsibilities. Elijah's name was trending on social media, but it wasn't just about the fame, it was about justice for the people who had been overlooked for far too long. The fallout was swift. St. Jude's Medical Center was placed under investigation, and it wasn't just a slap on the wrist, it was serious. Funding was frozen. Staff were reassigned, and the CEO, Richard Calloway, was put on indefinite leave pending a full investigation into his leadership. Elijah stood at his office window, watching as the sun set over the city. He hadn't anticipated how quickly things would move, but as the days unfolded, he realized just how powerful his actions had been. He had challenged a system, confronted the powerful, and forced them to look at the truth they had been avoiding for years. But there was something deeper, something he couldn't shake. The fight wasn't over. The investigation had only begun to uncover the layers of corruption and neglect that existed in the state's healthcare system. And Elijah knew that he couldn't stop now, not when so many had suffered in silence. The phone rang again. It was Nadine, her voice unusually urgent. "Elijah," she said, her tone serious. "You need to hear this. We found something else, something bigger than St. Jude's. It's connected to statewide health programs." Elijah's heart skipped. What was this? What had he just uncovered? He turned away from the window, his eyes narrowing. "What do you mean? What did you find?" "You're not going to like it," she said. "But this could change everything." Elijah sat in his office, the weight of the world pressing on him. The investigation into St. Jude's was gaining momentum, and while part of him felt a sense of accomplishment, there was an unsettling feeling in his chest. The deeper he dug into the state's healthcare system, the more he realized just how much was wrong. When Nadine's call came in, his first instinct was to pick up, but there was a part of him that dreaded hearing what she had to say. He had been awake for hours, going over reports, drafting more statements, and preparing for press conferences. The pressure was mounting, and the weight of his actions had begun to settle in. But when Nadine's voice came through the phone, all that faded. "Elijah," Nadine's voice was quiet, urgent. "I don't know how to tell you this, but what we found, it's bigger than just St. Jude's." Elijah's heart skipped a beat. "What do you mean, Nadine?" His voice was thick with concern. "I've been going through the files, digging deeper, looking at the reports from the state-funded health programs. You remember the complaints from those rural health centers we've been getting about the emergency services, right?" Nadine asked, her voice low. Elijah nodded, even though Nadine couldn't see him. The rural health centers had been experiencing problems for years: understaffing, lack of resources, poor oversight, but nothing had been done until now. "What about them?" Elijah pressed. "They're not just isolated complaints, Elijah. It's a coordinated failure across multiple health programs, state-funded programs, that are supposed to serve low-income communities. What we've uncovered points to a pattern of mismanagement and worse." Nadine's voice faltered slightly. "We're talking about funds being misallocated, resources being siphoned off, and the most vulnerable populations being systematically underfunded." Elijah's pulse quickened. His mind raced through the implications. Who's behind it? Nadine paused for a moment. When she spoke again, her voice was barely above a whisper. "I think it's coming from the top, Elijah. I don't have all the details yet, but the people pulling the strings are well connected. I'm talking about influential figures in state politics, health lobbyists, and even some members of the governor's office. They've been skimming the funds that were meant for community health care. And it's been going on for years." Elijah's world seemed to tilt. This wasn't just about one hospital, one poor experience. This was much deeper, a systemic issue that reached into the very core of state health policies. The thought of people, especially Black and Hispanic communities, being denied the health care they needed for the sake of profit was unbearable. He clenched his fist, the anger bubbling to the surface. "Elijah, you need to be careful," Nadine continued, her voice shaking slightly. "Whoever's behind this isn't going to let it go quietly. You're stepping on powerful toes, and they won't hesitate to discredit you, make you a target." Elijah took a deep breath. He had been a target for years, but this felt different. This was about more than his career. This was about the people he had dedicated his life to serving. The families who had been ignored, the children who had been left to suffer. "I'm not backing down, Nadine," Elijah said, his voice firm, resolute. "We've come this far, and I'm not stopping now. But we need to get the word out. People need to know what's really going on, and we need to make sure we're ready for the backlash." Within days, Elijah's team worked tirelessly to compile the evidence, ensuring every detail was airtight. The documents Nadine had uncovered were damning, and the state's health programs were now under intense scrutiny. Elijah once again found himself in front of cameras, but this time it wasn't just a routine briefing. This was bigger. As Elijah stepped onto the podium, the weight of the moment settled on him. The room was packed with journalists, their pens poised, their cameras ready. Elijah knew this wasn't just another press conference. This was the moment where the truth would be exposed, where lives would be changed, and where those in power would be held accountable. He took a deep breath, his eyes scanning the crowd before he began. "Ladies and gentlemen," Elijah started, his voice calm but resolute, "I stand before you today not just as the Public Health Commissioner, but as someone who believes in justice and fairness. For far too long, our most vulnerable communities, our Black, Hispanic, and low-income neighbors have been denied the care they deserve." He paused, allowing the weight of his words to sink in. What we've uncovered is not just a series of isolated incidents. This is a systemic failure. Funds meant for community health programs were misallocated. Resources were siphoned off by individuals with political ties, all while the people who needed them most suffered. These programs were underfunded intentionally to line the pockets of those in power. A murmur ran through the room, the journalists whispering to each other, incredulous at the scale of the accusation. Elijah pressed on, his voice growing more passionate. "Today I am calling for a full investigation into the state's healthcare system, starting with those responsible for the embezzlement of public funds meant for the care of the people. This will not stand. Those responsible will be held accountable." It didn't take long for the backlash to come. The governor's office immediately issued a statement distancing themselves from the allegations, claiming that the investigation was politically motivated. Health lobbyists with ties to powerful figures in state politics began circulating rumors, questioning Elijah's motives and accusing him of overstepping his bounds. They tried to paint him as a disruptor, a man who was more concerned with his own agenda than the well-being of the state. But Elijah wasn't intimidated. He had seen this before: attempts to discredit and silence those who spoke the truth. He had spent years watching those in power brush aside complaints, push aside the truth for the sake of profit. Now he was the one standing in their way. As Elijah sat alone in his office that night, the weight of it all began to hit him. The calls, the pressure from his colleagues, the smear campaigns already starting to surface, it was overwhelming. He had always known that standing up for what was right would come at a cost, but this felt different. He thought back to the families he had met during his visits, the ones who had told him their stories, the ones who had trusted him. They weren't just statistics to him. They were real people with real lives and real pain. Elijah's phone buzzed on his desk. He glanced at it. It was Nadine. "Elijah," her voice crackled through the speaker, "we've got a problem. The hospital isn't the only one with issues. There's more, and I think we've uncovered something even bigger." Elijah sat up straight, his heart racing. "What do you mean?" "We're looking at a network of hospitals and clinics, all with ties to the same people. This goes deeper than we thought." Elijah's mind began to race. "What are we talking about here, Nadine?" "I think it's a multi-state scheme, Elijah," she replied. "And I'm starting to think we're not just up against health systems, we're up against a system that's deeply embedded in politics and finance." Elijah took a deep breath, his mind working over the implications. He had stepped into a storm, but now he knew that what he had uncovered was just the beginning. The story was far from over. The stakes were higher now, and Elijah knew the fight was only going to get more dangerous. But he was ready. He wasn't just fighting for the people of Illinois. He was fighting for something much bigger. As the call ended, Elijah looked out his office window, a sense of purpose flooding him. "What's next?" he muttered to himself. And the answer came in the form of a single word: justice. The world outside Elijah's office was dark, the city lights flickering in the distance as the wind howled against the glass. Inside, the weight of what he was about to do settled in. The past few days had been a blur of media interviews, tense phone calls, and mounting pressure from political allies who wanted him to back off, to let it go. But Elijah West wasn't the type to back down, not when so many had been silenced for so long. His mind raced as Nadine's voice echoed in his ear. "This goes deeper than we thought." The network of corruption that had reached into the state's healthcare system was more expansive than they had ever imagined. The influence stretched into multi-state healthcare systems, and now the system Elijah had dedicated his life to was compromised on a level he couldn't ignore. But this wasn't just about politics or power. This was about the lives of people who had been overlooked for far too long, people who had suffered because the system failed them. Elijah's purpose was clear: Elijah knew it was time to take the final step. The investigation had revealed something more sinister. Health officials, elected representatives, and even powerful lobbyists had been diverting millions of dollars away from the hospitals and healthcare programs meant to serve vulnerable communities. The underfunding had caused systemic breakdowns across the state. Hospitals were understaffed, resources misallocated, and communities left to fend for themselves. But now it was his turn to push back. Elijah had secured the evidence he needed to hold these powerful individuals accountable. The media had caught wind of the investigation, and every major news outlet in the state was eager to report on the growing scandal. His phone buzzed again. It was Nadine. "Elijah, it's time," she said. "We've got the full report ready. The public's already been briefed. Are you sure you want to go through with this?" There was no hesitation in his voice as he replied, "I have to. They need to see the truth." The truth was ugly, but it needed to be heard. Elijah's next move was bold. In a televised address, he laid out the evidence, every document, every report, every testimony. He told the people of Illinois exactly how their healthcare system had been manipulated, how the most vulnerable had been exploited for profit. The room was silent as the weight of his words settled in. "Today I stand here not just as your public health commissioner," Elijah said, his voice steady but filled with conviction, "but as someone who believes in the power of accountability. We cannot allow this to continue. For too long our healthcare system has been failing us, and it is time for those responsible to face justice." He went on to outline the steps that would be taken: the immediate freezing of funds for hospitals involved in the scheme, an independent audit of all state health programs, and a call for a national conversation on healthcare reform. The response was overwhelming. Within hours, the news spread like wildfire. There was outrage, but there was also a sense of hope. Finally, someone was standing up to the powers that had long taken advantage of the system. But Elijah knew the real battle was just beginning. There would be legal battles ahead, political pushback, and countless attempts to discredit him. Yet, as he looked out over the crowd of reporters, he realized that the fight for justice was worth the cost. As Elijah sat in his office late that night, the phone calls from colleagues, allies, and even critics flooded in. Some congratulated him for his courage. Others tried to sway him, telling him to step down, to ease off the pressure. But Elijah knew deep down that the truth was far more powerful than anything they could throw his way. In this moment, Elijah understood that accountability was the key to change. It wasn't just about doing what was easy or safe. It was about confronting the hard truths and having the courage to act when others turned a blind eye. Elijah's journey wasn't just one of public service. It was a fight for dignity, for the people who had been ignored, and for a system that needed to be rebuilt from the ground up. The truth will always come to light, but only if we're willing to fight for it. Elijah West's journey is a reminder that no matter how powerful the system, change is possible when we hold ourselves and others accountable. His story shows us that sometimes the greatest battles we face aren't the ones we choose, but the ones we are called to fight when the stakes are highest. It's about the courage to stand alone in the face of corruption, knowing that the truth will eventually prevail. When you stand up for what's right, no matter the obstacles or the threats, you can spark a movement that changes the course of history. Elijah didn't just take on a hospital or a political system. He took on a deeply flawed structure that had been harming people for years. And he didn't back down. He showed us all that justice is worth the fight. If Elijah's story resonated with you, then this is just the beginning. Stories like these remind us of the importance of accountability, of fighting for what's right even when the odds are stacked against us. Subscribe now, share it, talk about it, and become part of a community that believes in these stories. For more stories that speak truth to power, expose the corruption hiding in plain sight, and remind us that we all have a role to play in making the world a better place.